Thank you, Dr. Jeffrey Matthews, for talking to the Op Report today about the surgeon's scorecard. What was or what is the surgeon's scorecard?
The surgeon's scorecard was a journalism project by the journalism in the public interest group ProPublica, and they basically took a Medicare database and tried to extract from that complications in terms of readmissions and deaths and so forth, and then tried to rate the surgeons based on a derived number from that, and then publish these results as a tool in the public interest to try to give patients access to surgeons' results so that they could select the highest quality surgeons for the particular operation that they wanted to, that they needed.
Right, giving information about the safety of surgeons so patients can check them out. Well, how can this go wrong?
Well, it's a great idea, and if it were straightforward and easy to come up with a score that measures how an individual surgeon does, you'd like that information to be out there so that patients can select. The problem is it's just not that simple, and the way the data are presented, the way the data are derived, gives a very inaccurate and false impression of quality. It's a false measure of quality, and it does not do what it is intended to do, which is allow patients to pick and choose based on real data, because the data simply aren't meaningful. Certainly not strong enough to be able to choose. I mean, it's just math. It's just statistics. It can't be used in the way that it's designed. And there's lots of reasons why that's the case.
Yeah. So who are the sorts of surgeons that will look good in that data, and who are the unfairly good, and who are the sorts of surgeons that will look unfairly bad in that data?
Well, I actually think it's difficult to tell, because although there was a nod in their methods to try to risk adjust, you can't really tell how accurate the risk adjustment was. So you really can't tell who's doing the more difficult cases or not. You don't really understand the patient populations and the likelihoods of patients being readmitted just based on where the hospital is located or the community that it's in. And then the numbers are so small that you really can't use that to determine who's a high-performing surgeon and who's not a high-performing surgeon. When I looked just out of curiosity at surgeons in the Chicagoland area who are at university hospitals or at outstanding community hospitals, of which we have many here in Chicago, and looked for surgeons that I know are outstanding, it was entirely random as to where they would be. And it is very hard to believe that that's true. There doesn't seem to be face validity to it. Mm-hmm. In addition, I think that their threshold for numbers is, if you hadn't done a certain number of, say, gallbladder operations, you wouldn't even show up on the list. Whereas I can assure you that the safest person to do your laparoscopic cholecystectomy, or among the safest surgeons to do your laparoscopic cholecystectomy, is a highly experienced, minimally invasive surgeon who does all kinds of advanced operations. And it just happens that in that insurance group of the Medicare and insurance pool, they didn't quite do the number threshold. But you know that these surgeons, and some of these surgeons aren't even listed in the database, so it's not really an accurate representation. And some people are falsely tagged with high complication rates, and some, through luck, who may or may not be good surgeons, are having have low complication rates, or as reported by that.
Right, and just the numbers for any individual are rarely going to meet a threshold of significance for.
Well, if you look at, so hidden within the publicly reported information on the ProPublica site are what they call 95% confidence intervals, which would say that the surgeon of interest here, the absolute number comes up making them a low-risk surgeon or a high-risk surgeon. Then there's the 95% confidence intervals, that it's 95% sure that they fall in within some distribution. If you look at those confidence intervals, almost all of them span their categories of high risk, medium risk, low risk surgeons. So any one surgeon is going to have a confidence interval that spans 2 or 3 categories of risk. So that's uncertain. Now you want to take that degree of uncertainty and compare it to another surgeon or another 3 or 4 surgeons who also have degrees of uncertainty. It's not statistically valid.
Right.
It's like, there's been a lot of controversy, a lot of things written about this, and I don't want to, I don't remember whose writing on this subject made the point, but made the analogy to baseball batting averages, which I think feels really intuitive. You don't figure out who the best hitters are based on 20 at-bats or 30 at-bats. It only really becomes accurate when you're looking at hundreds and hundreds. And the vast majority of the types of operations that surgeons do lots of different types of operations. So if they do 300 or 400 operations during a year, there's only going to be 10 or 20 or 30 of a given type of operation that they do. So to be able to compare that is really mathematically flawed. It's simply too granular to try to get it down to the level of the individual surgeon. You've got to aggregate much higher numbers of cases to try to get something that's really amenable to risk adjustment. It starts to be fair to both the surgeon and to the patient, so it's accurate for decision making. Mm-hmm. Again, great idea. I don't want to knock the motivation here.
Sure.
It would be great to have such information. The problem is it's a fantasy. It's very difficult to do at this kind of level.
Mm-hmm. Is there a setting where you can imagine it working better? A certain group of surgeons who do a limited number of cases, cardiac, for example.
Yeah, so this has been done in cardiac surgery, and probably it's the most where there's a smaller number of operations, and you can aggregate greater numbers. There may be some use there. I think that it is critical that the methods of risk adjustment be critically analyzed and demonstrated to be to be fair, essentially, to give an accurate representation of the patient populations. I think there needs to be buy-in from the surgeons themselves about how they're being measured. But we also have to be careful to understand the unintended consequences. And the cardiac surgery experience in New York and other places was you started to see risk avoidance behavior by surgeons not wanting to take on the higher risk cases, and I'm not sure that was good for public health.
Right. So do you think this effort overall should be abandoned, tuned up?
I think it is incredibly important that surgeons focus on quality, and organizations like the American College of Surgeons and other professional organizations have taken this very, very seriously to try to come up with quality measures. I am skeptical that we can boil down quality measures in surgery to a number. In other words, there's lots of things that happen that you want to adjust, but the idea that you could get a single number that reflects quality, that allows then obvious numerical, mathematical decision making about who's better than whom, I'm really doubtful that that's going to be there. However, the efforts of the individual surgeons to get their quality as great as possible is very important, and we should definitely be doing this and continue to do this, as the organizations are. Surgeons have been leading the way in this. This is not a new concept. Surgeons have been doing this for decades, and it's accelerated since the introduction of NISQIP and a variety of other collaborative efforts to try to understand institution-specific quality, process measures, to try to get better and better results. But the idea that you could come up with one number that says Surgeon X is better than Surgeon Y, and really have that be insightful and understanding, meaningful for consumers, I just think it's more complicated than that.
Yeah, yeah. Tougher question. Let's say you're traveling and you get appendicitis in a town where you don't know any surgeons, that would probably be unusual for you. But how do you choose a surgeon when you're in a town where you don't know anybody?
Yeah, it's difficult, and I understand the problem. I think if you are a patient or a family member, I think the only options that you have are to try to look around and understand the hospitals that are there, understand the sort of high-level quality of the hospital, understand the surgeon's training, have conversations with the surgeon about their experience and so forth. If it's in an emergency setting, the reality is it's very hard. You don't necessarily have a lot of options. If it's in the elective situation, you can do research, and you can go onto the American College of Surgeons website and get lists of the questions that you should be asking your surgeon about their experience, about their own results, and so forth. But the idea that you could go online and find a number, or that you could go on Yelp and get the answer based on 4 or 5 comments that are there that this person is better than that person. It's not like picking a restaurant. It's not like figuring out which florist you want to use. I understand the challenge. I don't know what the answer is. Mm-hmm. I know that the answer isn't go to a website and find a number.
Yeah, yeah. Last thoughts on the surgeon scorecard?
I think we have great responsibility as a profession to critically look at our results, to create a greater sense of public confidence and public trust in what we do. It is hard in the information internet age to balance out privacy, fairness, transparency, regulatory issues, all of these things together. But we have to keep working at it on behalf of the patients.
Great. Thanks so much for talking today. Appreciate your time.
Sure, you're welcome.
Thanks for checking out the Op Report. Help us keep conversations alive on topics in general surgery. Check out more episodes of the Op Report and other OnSurge content here at YouTube. Find us at Facebook. Follow us on Twitter. And find our homepage at onsurge.com. Join the conversation and tell us what topics you'd like to hear about and what people you'd like to hear from.